Start. Hello and welcome all. In this session, we are going to discuss the recall question of INI-CET May 22. This is the ENT chapter, and I am your ENT faculty, Dr. Sanjay Aggarwal. Now, in ENT, we had 4 questions actually. 2 were very straightforward, simple, and the other 2 were image based. Now, the point about image based question is that I cannot get access to the actual image that was shown, and so it might become difficult to discuss that. But based on the review and the feedback by you guys, we get a similar image and we can at least discuss those points, isn't it? So let's start with the first question. Now this was a question on this was an image of a CT scan showing a carcinoma of the larynx, and they asked you to classify T and M classification, T and M. Once again, because it's a image based question, I do not know the exact question, but I got a very similar image from one of the students, and this is how it looked like. But if you know the basics, you can answer this question very easily, very clearly, and for that you can review or you can refer back to the eGurukul app where I have discussed this in proper details. If you remember this, these are the screenshots of the from the eGurukul app and the PDF file. So as you can see that T1 is a tumor confined to, in this case you see, one subsite. T2, it is adjacent subsite. Now T3 is one of the 3 things: either the vocal cord is fixed, or there is invasion of paraglottic space, or the inner cortex of the thyroid is involved. And T4 is A and B, and A and B, which is outside of the larynx. T4 is outside the larynx, and in A it is very close to the larynx, and in B it is far away from the larynx. So if you remember, in my lecture I said T1 is one subsite. One subsite of the larynx means it is either glottis or supraglottis or subglottis. T2 is adjacent subsite. Adjacent subsite means from glottis it has gone to supraglottis, or from subglottis it has gone to glottis, like that. Also in supraglottis there are multiple subsites, like from the supraglottis, if it goes to the epiglottis to the false cord, there are different subsites. All this is given in your app. Now T3 is inside the larynx, but one of the 3 things: either vocal cord movement is involved, that means vocal cord is immobile, or spaces, paraglottic space, or inner cortex of the larynx. One of the 3 has to be there in T3. And in T4 it is outside the larynx, basically outside the larynx. T4A is close by, close to larynx, and obviously T4B is away from the larynx. In this, one of the 3 has to be involved: either prevertebral space, or mediastinum, or encasing the carotid artery around the carotid artery. If any of the 3 is involved, it becomes 4B. If none of the 3 are involved, but it is outside the larynx, it is 4A. And this is what I tell you to remember in the app, in the classes, right? Now coming back to this image, now we cannot see all the lymph nodes. Now to see the spread from the glottis to supraglottis and subglottis, you need a coronal section or the sagittal section. The image which was shown was most probably an axial section like this one. In axial section, whether it is going to involve supraglottis and subglottis and glottis, which are these 3 areas, is very difficult to know in an axial image. You can know that in a coronal or the sagittal image. However, in this axial image, you can know whether it is within the larynx or outside the larynx. Now if you look at here carefully, the cartilage of the larynx, thyroid cartilages, are supposed to be like this, and you can very clearly make out that the tumor has gone outside of the cartilage. It has broken the cartilage. You can see the arrow, which means it has gone outside the cartilage of the larynx. Therefore, it has to be at least 4. Stage 4 has to be there. It could be 4A and B, but since B is not given 4B, it has to be 4A in this particular image, right? So this has to be 4A's, and the only choice having 4A is D, and therefore D is the correct answer. Maybe there is N1. Now N1 is lymph node which is less than 3 centimeter, N2 is 3 to 6 centimeter, and N3 is more than 6 centimeter. But of course in N2 there is A, B and C also. Similarly N3 has A and B. Again, everything is given in the app, you can go and check there. But very interesting thing about the N classification of the head and neck region is that N classification for all head and neck tumor is the same. There are 2 exceptions. One is thyroid tumors, and the other, which is ENT important, is the nasopharyngeal carcinoma. In nasopharyngeal carcinoma, the N is different from rest of the head and neck tumors, and that's why it makes sense that you go and check what is the N classification of nasopharyngeal carcinoma, because that's more important than this one. Okay. So once again, to review, A, if the tumor is within the larynx, not going outside the cartilage of the larynx, it is either T1, T2 or T3 depending on what is involved. The once it is outside of the cartilage of the larynx, like in this case, it has to be T4, maybe A, maybe B. In this case, it is perhaps A. And like this, these are the screenshots of the app, that eGurukul app, right? And this is the PDF file showing how we have discussed all the staging of the laryngeal carcinoma there. Everything is, and based on that, the treatment has been discussed in details again. Whether the treatment, the surgeries, the surgical options, all that has been discussed. So please go and check this one. Let us go to the next one. This is another very interesting question. Again, image based question, so we cannot be very sure what the image was like, but it was a very similar image in the exam. So the question was like this: given alongside is an image of tympanic membrane with retraction pocket. What is the grade of this retraction pocket? Now we have discussed this. The retraction pocket is graded by a person called TOS. Is it grade 1, grade 2, grade 3, grade 4? And in the app, I have discussed the difference between retracted tympanic membrane versus retraction pocket of the tympanic membrane. So this is about pocket, which ultimately causes formation of laryngeal carcinoma. So the image is a tympanic membrane, and this is the area of the pars flaccida, Prusac space to be more precise, and you can see there is a retraction, and this looks like grade 1 retraction. Now why grade 1? Because in grade 1 there is retraction, but it is not up to the neck of malleus. In grade 2 it is not up to neck of malleus, and in this you cannot see the neck of malleus, you cannot make out the neck of the malleus. This is up to neck of malleus, but no erosion, no bony erosion is there. In grade 3 there is partial erosion. Erosion of which bone? Erosion of a bone called scutum. Scutum forms the outer boundary of the Prusac space, and grade 4 is complete or total erosion, of course, of the same bone, which is the scutum. This is the classification of retraction pocket into 4 grades, and in this case the image that I have used is of grade 1 retraction. Now let me tell you that there are 2 things I told you. There is retraction of the tympanic membrane, which is different from retraction pocket of the tympanic membrane. In retraction of the tympanic membrane, which is seen in blue here, to know the grade by looking at the image is pretty easy. You can see the structures in the middle here and you can make out what grade it is. But in retraction pocket, because it's a very small area, tiny little area, by looking at the image to know the grading, just looking at the otoscopic image to know the grading becomes pretty difficult. You can only know these things by using a scan also, because this bony erosion, they are very small bony erosions and they can be seen on a scan properly rather than otoscopy. So why I am saying all this, because if they ask you a retraction pocket grading, it is going to be either grade 1 or grade 2 in most cases, because grade 3 and grade 4 on otoscopy becomes difficult. Of course, if you microscopic examination or CT scan, then grade 3 and grade 4 can also be diagnosed easily, but not so much on otoscopy. So this is just a hack, that if they ask you a retraction pocket grading based on otoscopic exam image, it is either grade 1 or grade 2, because these are the ones that can be diagnosed more easily on otoscopy, not grade 3 and grade 4. Now this is the normal tympanic membrane. Typo is normal. See, this is the pars flaccida, and this bone is what? This bone is scutum, and this area is the area of Prusak space, and this area is neck of malleus. Neck of malleus. See, this retraction membrane should be like this ideally, but it has been retracted, but it is not up to incus. So grade 1 up to the neck of malleus, sorry. In grade 2, see, it is going up to the neck of malleus. This is a tympanic membrane up to neck of malleus, but this scutum has no erosion at all, isn't it? So this is grade 2. This is neck of malleus, but can you see the erosion here? Slight erosion, partial erosion, and therefore it is grade 3 retraction pocket, and here it is more profound erosion. All this much is gone almost, suggesting, and therefore it is grade 4 retraction. Okay, so very easy to remember if you know this, but like I said, it is given in your app. So if you have seen the app, eGurukul app, you'll have no problem answering this question. So this is what it says. Grade 1 is retracted onto malleus. Grade 2 is this is a different kind of classification, where they have used grade 4 grades, 5 actually. Now 5 is not taken normally, because 5 is colostoma. So after grade 4, what happens is a colostoma formation, and colostoma formation, which in this is grade 5, is a different entity, different disease altogether. You know this already. Now these are the images where you can see grade 1, this is grade 1 retraction, and can you see, you can make out there is erosion in this area also, there is erosion of the bone. So it is either grade 3 or grade 4, because you can see the erosion also. So these are the different images showing you how different grading of the tympanic membrane retraction pocket may look like. And I'm sure you understand that it's not easy, it's very difficult. That's why I said that if they give you in the exam, they'll either give you grade 1 or grade 2, because grade 3 and grade 4 on otoscopic examination becomes more difficult. Yes, CT scan can be more easy, more helpful in knowing grade 3 and grade 4 retraction pocket. Retracted tympanic membrane is much easier to diagnose on a otoscopic examination, which is a different thing altogether. But we'll go on to, so this is the image from the PDF file showing that I've explained. Can you see this retraction pocket here? This Prusak space with the help of an image. Here you have the, see, this is pars flaccida retraction pocket, pars tensa retraction pocket. What is the difference between the two, pars flaccida and pars tensa? Why they look so different? All this has been explained in the eGurukul app. So please go and check that. I highly recommend. And this is showing you the grading, different gradings. Again, PDF file image is this. Next one, the same thing with the image. See, this is retracted tympanic membrane, and this is retraction pocket of the tympanic membrane. Again, PDF file image. And how do you differentiate between the two? What do they indicate? All that is being given very, very nicely. So I highly recommend that you check this one out if you don't have an idea. Okay. Next one. A patient presented to emergency with acute vertigo with horizontal nystagmus, slow component towards the left side. What is most likely diagnosis? Posterior canal BPPV, superior canal BPPV, left hypoactive labyrinth, and right hypoactive labyrinth. It's a very interesting question. It's not a difficult question, very interesting question. If you have been following me, you will have no difficulty in answering this question. If you have read, if you have watched the app, the eGurukul app, that chapter on caloric test and the chapter on BPPV, then you will be able to answer this very easy. Now, nystagmus can be horizontal or vertical, even rotatory. Now, horizontal nystagmus suggests it is ear problem, especially lateral canal problem. Vertical and rotating nystagmus may be cerebral problem, or superior canal may be posterior canal problem, right? So this is one thing, and this is given in your app, how to differentiate between peripheral nystagmus and the central nystagmus. So you can go and check that. Now this says there is horizontal nystagmus. Okay, this proves that it is ear problem, and that too mainly the lateral canal. Second thing, when you have horizontal nystagmus, it is a fast phase and a slow phase. Now fast phase decides the direction of nystagmus. Nystagmus is right sided or left sided. We decided which side is the fast phase. Now in this it says the slow component is towards the left side, which means the fast component is to the right side. So it is right sided nystagmus. This is because fast decides the direction. This is right sided nystagmus. Okay, because the slow is on the opposite side, so fast component has to be on the right side, and the fast component decides the direction of the nystagmus, and since the fast is on the right side, it is right sided nystagmus. So these two things we know from this much. And the third thing is cows. Remember, cold water will give nystagmus to the opposite side, and warm water causes nystagmus on the same side. This we know, everybody knows this. Now if you have seen the app, watch the app, eGurukul app, I told you there that cold temperature causes hypoactive, and warmth, when there is inflammation, there is the temperature rises, so there is hyperactivity. So whether you say cold or hypoactive is same thing. If a tissue is placed in a cold temperature, it becomes hypoactive, the activity decreases, isn't it? The opposite is warm. If the tissue is placed in a warm temperature, it becomes hyperactive. So we can say hyperactive nystagmus causes opposite side, hyperactive disease causes nystagmus on the same side. Now this particular nystagmus is of the right side. So either right is hyperactive, because hyperactivity causes nystagmus on the same side, or left is hypoactive. Both are possible. So any of the two given in the choices is a correct answer. Hyperactivity causes nystagmus, which is like warm water, causes nystagmus on the same side. If it is right side, hyperactivity will cause nystagmus on the right side, and hypoactivity, which is like cold water, will cause nystagmus on the opposite side. So if it is right sided nystagmus, maybe the left ear is hypoactive. So any of the two given in the choices will be a correct answer. And this one is not given in the choices, this one is given in the choices. So left is hypoactive labyrinth. So left is hypoactive labyrinth. Posterior canal and superior canal will most probably give vertical or rotated nystagmus, not horizontal. I told you all this. And right ear hypoactive will cause nystagmus to the left side. Hypoactive is like cold water. If it is right side disease, it will cause nystagmus to the left side, but we already know this is nystagmus on the right side. See, in one question, they have checked so much of your information, your knowledge, whether you know the difference between peripheral and vertical nystagmus, which one causes what kind of nystagmus, horizontal versus vertical, which part of the labyrinth causes what kind of nystagmus, and then this cows, which is a very common mnemonics, and also whether you understand that cold water is same as hypoactivity and warm water is same as hyperactivity. But if you have watched the eGurukul app, I'm sure you'll know this, right? Okay. And this is the image from the PDF file of eGurukul, where we have discussed all these things. You can see this. Can you see peripheral nystagmus versus central nystagmus, and cows and all is given everywhere in this app also. So very easy. Pass component decides the direction of the nystagmus. Everything is given in that PDF file. Okay. Next one. Now this is a straightforward simple question. Arrange in order of the calic nerve in its hearing pathway. First is cochlear nucleus, second is superior orbital nucleus, third is inferior colliculi, and fourth is medial geniculate ganglion. That mnemonics E. coli ma, remember? We have discussed this in the classes and in the app, E. coli ma. So I told you in the classes that the sound travels from the external ear to middle ear, and then it goes to the cochlea, inner ear, which is inner ear. Okay. Now from here on, the sound travels through the eighth nerve, and then it goes to the brainstem. Which part of the brainstem? Cochlear nucleus. Cochlear nucleus. From there it goes to superior olivary nucleus. SON stands for superior olivary nucleus. From here it goes to lateral lemniscus. Then it goes to inferior colliculi. Then it goes to medial geniculate ganglion. So this is the part of the brainstem, and then it goes to the auditory cortex. So this is the path it takes, isn't it? And this part of the nerve is in the brainstem. It's like a repeat from the app, right? So if you look at this pathway in the brainstem, this is cochlear nucleus is the first area. Then it goes to superior orbital nucleus. This is the second area. Lateral is not given in the choices. Third was this one, and this one given as the fourth choice. Remember? So from cochlear nucleus to superior orbital nucleus to inferior colliculi and medial geniculate ganglion, this is the pathway is going to take. This is E. coli ma. E is the eighth nerve. Eighth nerve is E. This is C, O, L, I, E. coli, and M, A. This mnemonic is given in most of the books, so it's not difficult. Okay, easy, isn't it? And these are the images from the PDF file of the eGurukul app, where we have discussed this auditory pathway. You can see superior olivary nucleus of the cochlea, superior olivary nucleus, inferior colliculi, and medial geniculate ganglion. So these are the 4 questions from the ENT part of the INI-CET exam. I hope you have answered them correctly, and now you know why these answers are correct. Now this may be reproduced in the NEET PG exam also, because that's your main target. I'm very sure most of you are targeting NEET PG, and keep studying, guys, because there's too much of confusion around. The time is not that much. Don't waste your time trying to get the news. Just keep studying, because ultimately at the end of the day you have to study, and there is no other shortcut, there is no other pathway. So don't waste your time trying to discuss all these things with your friends. Just keep studying. Whenever the exam is held, unless you have studied or prepared well, you can't clear the exam, isn't it? So keep studying. Any problem, you can always contact us. Till then, goodbye. Take a very good care of yourself. God bless you. Stop.